So that's an excellent question. Osteoarthritis is a progressive degeneration of the joint. It results when the protective surface, also known as cartilage, that allows the joint to move smoothly, is damaged. Over time, the cartilage is worn away and adjacent bones are remodeled as the joint becomes increasingly abnormal and rusty, resulting in pain and stiffness. The term osteoarthritis is derived from the three Greek words meaning bone, joint, and inflammation, and traditionally thought of as a disease of progressive wear and tear. Its key pathological changes actually is local loss of cartilage, bone remodeling, and osteophyte formation. Instead, supporting the view that it is actually a dynamic repair process which has gone wrong. The common picture of arthritis of the shoulder is one of pain, stiffness, and so of decreased capacity. Osteoarthritis of the shoulder is less common than many other joints, principally like the hips and knees. However, it is a debilitating problem and can have a significant impact on the patient's life. It increases with age, as you would assume, and more likely in patients over 60 years old. It is commoner in those with history of dislocations, and we've looked at studies which have demonstrated that almost 50% of patients with this joint dislocation might have arthritis 20 years plus after the first episode. There are different causes. We regard osteoarthritis as primary or secondary. Primary is arthritis that happens without a preceding event. And secondary would be the arthritis that would happen secondary to trauma, dislocation, inflammatory arthritis, crystalline arthritis like gout, avascular necrosis or altered vascularity of the humeral head, those who have rotator cuff tears that wasn't treated and led to rotator cuff arthropathy, previous shoulder surgery, especially open surgery, history of trauma, and those who have what we call overuse syndrome. By that, we mean individuals who engage in high intensity overhead activities such as weightlifters and racket sport players might be at increased risks. The symptoms of shoulder arthritis vary, and actually patients with arthritis will classically complain of a stiff and painful shoulder with a limited range of motion, and the description of pain and stiffness that intensifies with use is standard here. Also, disruption of sleep, crepitus, or what we call catching and noise heard during movement is another routine finding. Pain is always the most common symptom of arthritis of the shoulder. The pain is aggravated by activity and progressively get worse over time. And the location actually of the pain might vary depending which part of the shoulder joint is affected. If it is the main ball and socket joint, the pain is centered in the side or the back of the shoulder and may intensify with changes in the weather. Patients complain of deep achy pain in the joint. If the pain is actually in the joint we call acromioclavicular joint, so the pain would be focused on the top of the shoulder, and the pain can sometimes radiate or travel to the side of the neck. Patients with rheumatoid arthritis might have pain throughout the shoulder if both joints are affected. Other symptoms, as I've mentioned earlier, would be limited range of motion, crepitus, and some patients will have night pain, which would be affecting their sleep. Actually, that's an excellent question. Personally, I believe by managing pain and symptoms, many people with arthritis can continue to exercise and enjoy sports. Seeking treatment early can help. To avoid pain, sometimes people stop exercising, but it doesn't have to be that way. High impact sports and repetitive motion can contribute to arthritis, but patients shouldn't be afraid to exercise. Research has shown that even certain sporting activities doesn't really increase arthritis among individuals. The key here is to be active or weak. Weekend warriors are more prone to injury. So if you have a desk-based job, you have to try to maintain a certain level of exercise during the week. Tips you can have for staying active include exercising a few times a week, stretch before exercising, be aware of your anatomy, weight, past injuries, a past history of injuries and family history. Be aware of contact sports if you have arthritis of the shoulder, because that might be aggravating your shoulder problems. Generally speaking, and if you have a sprain or injured tendon, you should stop activity for a limited period of time. After exercise, and if your shoulder is painful, you can use ice. If you have swelling and you know you have overdone it. Generally speaking, keeping fit is crucial for your overall health and your joint health specifically. And your shoulder arthritis shouldn't stop you from doing exercises. So it is a so as with everything else, our initial treatment of arthritis of the joint of the shoulder is non-surgical. We usually recommend different techniques and different tricks and non-operative options. These include rest, change of activities, as you may need to change the way you move your arm to avoid provoking pain. Physiotherapy exercises can improve the range of motion in your shoulder. Non-steroidal anti-inflammatory medications such as aspirin, ibuprofen, naproxen can reduce the inflammation and pain. Be aware that these medications can irritate the stomach lining, and so you have to discuss with your GP or your surgeon before taking them, especially for long period of time. Another important bit to do is to take them after meals. Steroid injection has been tried before to reduce the inflammation and pain. However, the effect is often for a limited period of time, and we know from evidence that there is associated risks with intra-articular steroid injections as well. Moist heat can provide temporary relief. Icing your shoulder for 20 or 30 minutes, 2 or 3 times a day, can reduce inflammation and ease pain. If you have rheumatoid arthritis, your rheumatologist or general practitioner might prescribe some disease-modifying drugs that would significantly improve your symptoms. Other options include platelet-rich plasma, which is gaining a lot of popularity, and there is some evidence supporting the use of platelet injections or stem cell injections in the shoulder. However, this might not work if you have advanced arthritic changes. Generally speaking, physiotherapy in the form of anterior deltoid strengthening and exercises plus or minus injections usually can help. Natural history of arthritis, you will have significant pain and things improve, and so surgery is not really needed all the time. What about the surgical options? Sometimes, if all what we've mentioned about the non-operative measures has failed to improve symptoms, there are different surgical options, and these range from arthroscopic treatment or keyhole surgery, in which sometimes we can stick a TV camera inside and the joint is tied up. For advanced arthritis in elderly patients, we do not tend to do this. However, this option is a valid option in younger patients where there is a potential benefit can be achieved in the form of microfracturing or doing regenerative procedures and bone preserving procedures. If the non-operative treatment exhausted in elderly population or any patient in cases with severe non-resolvable pain or previously failed treatment options, shoulder replacement or arthroplasty is indicated, and there are several variations of shoulder replacements, some more invasive than the other. The choice of the replacement surgery depends on several criteria. These include age, activity level, what form of arthritis, the amount of bone affected, the amount of bone loss, and the quality of your tendons. And the different options include just replacing half of your shoulder joint, or a total shoulder replacement, or what is more commonly used nowadays is a reverse shoulder replacement, in which we would try in patients who has completely torn rotator cuff with severe arm weakness and had previous, or those who had previous shoulder replacements that failed. We've published our results of 5 years of 159 of these, and actually the significant improvement is maintained over the years after this type of surgery. Thank you.